Hello everyone. Today we are going to discuss a serious disease called rabies. So, let's start that what does the word rabies means? Rabies is a Latin word which means madness. It is also related with the Sanskrit word rebus, which means violent and uncontrolled anger. We can also relate it with the Greek word Lassa means violent. Lassa virus is also the genus of the rabies virus. Madness, uncontrolled anger, and violence. These are the signs and symptoms of the rabies disease which may appear when disease gets severe. Rabies can be defined as it is a viral disease that causes the acute encephalitis, means the inflammation of the brain in human and other warm-blooded animals. So rabies is also a zoonotic disease, which means that the disease is transferred from animals to humans and can also affect the other warm-blooded animal, which is then can be used further for spreading the disease. Rabies is also known as hydrophobia. Hydrophobia is actually the fear of water. The question arises here, why patient afraid of water? The answer is that when rabies virus reaches to the CNS and affect the other organ like respiratory tract, so the virus causes the muscular spasm in throat and the patient is unable to swallow or drink anything. Even the thinking of drinking can cause the muscular spasm. So due to this muscular spasm, the hydrophobia arises. We will discuss it in detail in coming slides, and the last point of this slide is the causative agent for the rabies disease is rabies virus. These are some sources from which rabies transfers to humans and to other animals. They are dogs, cats, jackals, bats, wolves, etc. Other animals may also be involved, but these are the main sources. In South Africa, India, and in some other countries, dogs is responsible for about 90% of spreading of rabies, and in US, the leading source is bats. And the host for the rabies virus is warm-blooded animals including human. We should also remember that rabbit is also warm-blooded, but this is excluded, and the reason is that it cannot tolerate with rabies. Now we will discuss the routes through which the rabies enters to the host bodies. Rabies may be enters through biting of the animals, scratches, licks of the infected animals, and aerosols. Bats are mainly enters through aerosols, but bats can also bite the host and their teeth are too much small even that the host cannot feel the biting if he or she is sleeping. As we discussed in the above slides that the dog is the main source of spreading rabies disease, so a single dog has the ability to spread the rabies in 40-kilometer area. Now coming toward the general structure of rabies virus. The virus which causes rabies disease is rabies virus. The genus is Lassa virus. It belongs to family Rhabdoviridae. The shape of the rabies virus is bullet shape. Size of the rabies virus is 180 nanometer long and 75 nanometer wide. Nucleocapsid of rabies virus that it contains the negative single-stranded RNA, and the RNA is in helical shape. 5 different types of the proteins are responsible for making the structure of rabies virus. Number first, lipoprotein makes the envelope of the virus. Number 2, glycoprotein is responsible for making the surface spikes which help in attachment to the host receptor acetylcholine. Number 3, matrix protein makes layer beneath the envelope. Number 4, nucleoprotein is responsible for making the nucleocapsid, and number 5, polymerase protein help in transcription and translation of rabies virus. Pathogenesis of rabies disease. First of all, what is pathogenesis? Pathogenesis is the manner of development of disease or the process by which a disease or disorder develops. So, in these slides, we will elaborate the pathogenesis of rabies disease, that how it develops is shown in the figure. In first step, the virus enters the tissue from the saliva of the biting animal. In the second step, it will replicate in the muscle near the biting site and enters to the neuron of the peripheral nervous system. In next step, it will move up to the CNS, means spinal cord and brain. Passing through the spinal cord, the virus ultimately reaches to the brain and causes the encephalitis, the inflammation of brain. And after some time, the virus enters to the salivary gland and other parts of the victim. So by this way, rabies develops. Incubation period of rabies virus. Incubation period may be defined as that it is the time between infection with the agent and the onset of signs and symptoms. It means that the incubation period is the duration gap when rabies virus enters to body until the sign and symptom gets appear. The incubation period may be short up to 1 or 2 weeks and can be long up to 1 year, but it depends on the following points. Number first, site of bite. It means that if the biting is away from the CNS, so the virus will take longer time to reach to the CNS and the incubation period will be long. And if it is near to the CNS, the incubation period will be short. And I think that this point will be clear to you people, that how the rabies virus move to the targeted area as we studied in the above topic, pathogenesis. Number 2, severity of bite. It means that if biting is severe, deep and more biting at the site, so the incubation period will be less. On the other hand, if it is only scratches or licks, the incubation period will be long. Number 3, the amount of virus injected. It is obvious that if more virus enters to the body, the incubation period will be short and vice versa. Number 4, treatment taken or not. If we are going to take the treatment, the incubation period will be long, and if not, the incubation period will be less and more chances to appear the severe signs and symptoms which leads to death. Now going toward the diagnosis. In case of humans, some tests are performed to ensure that rabies is present or not. For that, we simply take the saliva and spinal fluid and test it. And in case of the animal, we perform DFA, direct fluorescence test. Signs and symptoms of rabies virus: fever, headache, and weakness. These are the common and general symptoms of rabies, but when the disease gets severe, the following symptoms appear. Number first, difficulty in swallowing. Hydrophobia means fear of water, and the reason behind the fear of water is muscular spasm in throat. So the patient is unable to swallow or drink anything even if the thirst is at high peak, but only the thinking about water makes muscular spasm and make the patient fear of water. Number next, agitation, a state of anxiety or narrow excitement. Hypersalivation means increase in saliva. Insomnia, trouble in sleeping, means the sleeping pattern get disturbed. Anxiety, feeling of fear and uneasiness. Confusion, hallucination, seeing the things that are not really present. Slight or partial paralysis. Some other symptoms may also appear, and ultimately the patient leads to death if not prevented. Prevention of rabies disease. The best way to prevent and make ourselves safe from rabies disease is to get vaccinated. First vaccine for rabies was developed in 1885 by Louis Pasteur. Before starting the topic, you should know that what is pre-exposure prophylaxis. Pre means before, exposure means exposing, and prophylaxis means treatment given or action taken to prevent disease. So in short, some doses of vaccines are taken before exposing to rabies. This is actually called pre-exposure prophylaxis. They are provided to those subjects who are at high risk. They are lab workers, biologists, veterinarians, dog handlers, and hunters. We will give one dose of vaccine at day 0 means at day first, then one dose at day 7, and another dose will be given at day 21 or 28 as shown in the figure. If this person gets rabies in future, he or she should take another 2 vaccines to complete the full course of rabies vaccine. Now, if a person gets exposed to rabies, what we will do? We will do post-exposure prophylaxis, means that we will take some steps or actions after exposing to rabies to prevent that person. First of all, we will do wound care, and next step we will provide rabies immune globulins for those patients whose immunity is weak, and in third step we will go for full vaccination course. We are going to discuss these 3 points in more in detail in coming slides step by step. First step in post-exposure prophylaxis is wound care. In wound care we will do cleansing. Wash the area thoroughly, preferably for 10 to 15 minutes with soap. Apply pressure. If bite is actively bleeding, then we will apply pressure to stop bleeding. Chemical treatment is done to prevent the area from more contamination. The chemical involves are alcohol, iodine, or any other antiseptics. And last, these are some agents to which the rabies virus is sensitive. They are ethanol, detergents, ether, chloroform, acetone, UV rays, etc. The second step in post-exposure prophylaxis is rabies immune globulins. What is rabies immune globulins? It is a sterile solution made from human plasma. It contains antibodies that protect you against infection from various diseases. Why we are using rabies immune globulins? Because to boost up our immunity. There are 2 types of immune globulins: human rabies immune globulins HRIG and equine rabies immune globulins ERIG. Human rabies immune globulins is prepared from human plasma, and the next one is taken from the horses. We can use both of them. They are recommended by WHO. The last step in post-exposure prophylaxis is vaccination. We can do vaccination intramuscularly as well as intradermally. But here we are discussing 2 schedules of intramuscular vaccine. First one is Eastern schedule. In Eastern schedule, 1 dose will be given at day 0. Next one will be given at day 3. Then at day 7. Then at day 14. And the last one is at day 21 or 28. Calculating all, we give 5 doses in Eastern schedule. Now in Z-grip schedule, 2 doses will be given at day 0, 1 dose will be given at day 7, and the last 1 dose will be given at 21 or day 28. Day 14 is missing in this schedule. Calculating all, we give 4 doses in Z-grip schedule. These are some rabies vaccines prepared in Pakistan by different manufacturers. Number first is Verorab, manufactured by the Sanofi Aventis. Second one is Rabipur, manufactured by the Novartis. And the last one is Lasavec N, manufactured by the Hakim Sons. Okay, so this was all about rabies disease, and thanks a lot for watching the video. Feel free to ask any question in the comment box. We will definitely respond to your question. Special announcement for you people. If you people want us to make a specific topic for you, please comment the name of the topic. We will make it for you, and especially we will highlight the name of that person in our video. And last, if this video is beneficial for you, please don't forget to subscribe our channel Pharma Leaders. Thank you once again.